Namaste yogis, Holly here with Integrative Yoga Method. Today I want to share with you one of my favorite techniques for releasing jaw pain. So before we get started, be sure to like this video, subscribe to our channel, and if you know anyone that deals with headaches, tension through the jaw, TMJ, send them this video and let us know how it works for you. So this is a technique that is adopted from, I myself am an integrated positional therapist. And this is a technique that I use on clients when I work with them that are dealing with jaw pain, but I actually like to teach my clients how to do this for themselves because I feel that you get a better result because they can really feel where they need to stop or where they have some more room to groove. So I'm not in their body. I can't feel what they're experiencing. So I really like to teach my clients how to heal themselves, right? So you've got this muscle in your jaw, and it's the strongest muscle in your body pound for pound. So when it starts to build tension, it can cause a cascading effect, right? Whenever it's so strong, and we need that strength for chewing and all sorts of things, but that tension can really start to reverberate and cause those tension type headaches to the pain, into the temples, the temporalis muscles. So this is a great kind of first line of defense, even if you're not dealing with TMJ, which I myself don't deal with TMJ, but I do tend to hold a lot of jaw tension. So this is something I do almost every day, right? So for this practice, all you need is a nice tall spine. So grab a comfortable seat and we'll get started. And if you want to explore, just at first, I like to use a couple fingers, kind of palpate around the sides of the jaw, feeling your masseter, right? And again, it's this little muscle, but it's so strong. So if you palpate around and it feels a little tender, that's a sign that obviously it's probably holding some tension. So first, we're just going to let the jaw kind of slacken a bit, kind of hang, all right? Create a little space. This is one of those practices that you look really cool while you're doing. So I like to do it at home by myself. So jaw's going to relax. And then all we're going to do is, again, I like to use two fingers, and then we're going to slide the jaw towards the other side, towards the ear. So which is going to create a stretch on this side. But as I slide it to this side, we're actually putting slack on the muscle. We're bringing the two ends of this little muscle closer together. This is a technique called strain counter strain, or positional release, as I like to call it. And it's kind of magical when you bring the two ends of a muscle closer together and you actually allow that muscle to relax. So it's not like a contraction where you would bring the two ends of a muscle closer together and it's contracting. You relax it and you hold for about 60 seconds. The fibers in the muscle actually reset back to neutral. So whether they were overstretched or if they were really short and tense and tight, they're going to come out being kind of in a more neutral place, and oftentimes those trigger points or as tension gets released with it as well. So again, we'll start with the left side, bringing fingertips over to the left side, create that little bit of slack, let your jaw kind of hang, and then we're going to slide to the side. Good. So you can see I'm shortening this side. This side's getting a stretch. So for you, one may be more beneficial than the other, but you're going to get both with this release. So jaws relaxed, we're going to slide over. And now what I want you to do is take a deep breath in. Hold your breath, and as you're holding your breath, actually push your jaw back to the side. So I'm contracting this side, holding my breath. You don't have to talk when you do this, so it's easier. And then exhale, let your jaw relax, and you can see it sliding more to the side with that, right? Inhale. Hold your breath. Push your jaw back to the side. Exhale, relax. So we're creating more slack here and more of a stretch here. We'll do that one more time. This time I'm not going to talk. I'm just kind of look what it would look like normally. So you'll inhale and hold your breath. Push back. Good. Now, I want you to hold this position. So I'm going to come off. I'm not holding it anymore, but you at home, as long as there is no pain, no discomfort, sometimes if you go too far, maybe you feel it in your ear, you start to feel those referral patterns, right? So make sure that wherever you land, it's as comfortable as you can. I know it's kind of an awkward position. So you're just going to hang out here, right? Staying really relaxed. There's still that space between the upper and lower rows of teeth, so the jaw is kind of hanging. And again, you might feel more sensation on the side that's being stretched. As you start to hold for that time, again, it takes about 60 seconds. The side that we're pressing towards is getting this technique called positional release or strain counter strain. This is an osteopathic release technique. So give it some time and just staying really relaxed through your face and really soft through the jaw. Let's take 2 more really deep breaths here. Just kind of commit to holding. I know the first time I did this release when I learned it with my teacher, Lee Albert, it felt like I had a new mouth. It felt like I had a new jaw. I had had so much tension there so long. I didn't know what it felt like to not have that tension there. So as you come out, I want you to come out really slow, just releasing. Come down to the side. Kind of sigh it out, maybe open and close, and just notice, like, does the side that was getting the stretch, does that feel more open? Or does the side that got the release feel more open? We're all a little bit different, and every day it can be different. So kind of notice that, maybe palpate, and then let's do the other side. So first you're going to let the jaw kind of slacken, let it hang a little bit, and then we're going to slide, use the other side and slide towards that side. So now, obviously this side's getting the stretch, this side's getting that release, that positional release, right? So I'll guide you, and as we push back, this is that technique called muscle energy technique. So as you push your jaw into your fingertips, if you've seen on some of our other videos where we use this technique, I only want you to use that like 10 to 20% of your strength, especially if it brings on any pain or discomfort. Sometimes we even just omit the MET and we just hold for that stretch and the positional release until the body's kind of ready for that. So please listen to your body. You are your best guide. So inhale. Hold your breath, and then push your jaw back to the side. Big exhale, relax. And you might notice, hey, my jaw has a little bit more range of motion. As I stretch this muscle, I can go a little bit further, but we are not forcing anything, right? This should all feel good. We've got 2 more rounds. Inhale, hold, push your jaw back into your hand. Exhale, relax. Last one, inhale, hold. Gently push the jaw back into your hand. Exhale, relax. So again, you're gonna hold, I'm gonna come off just so I can talk, but you're gonna hold this, kind of committing to that 60 seconds to really let that side that we're putting slack on get the full benefit of the positional release, as well as the side that you're stretching. If we're looking into working with the fascia or the soft tissue of the body, which this is going to affect not just the jaw, but even through the side of the head, the temporalis muscles, as we stretch down here, there's going to be an effect other areas of the body. And to get to some of those deeper layers and the soft tissue, it takes about 60 seconds for the fascia to respond to a stretch, whereas like muscles take about 30 seconds or even less. So commit to that time. And the biggest thing is that you're as relaxed as you can be while you're here. So like face should be really soft, jaw is soft, and just kind of commit and just notice. A lot of times I might just start to feel like some warmth into the ear or some tingling in the side of the head, maybe a release through the neck. Again, just kind of let this be interesting. This be like a little minute of meditation, just kind of noticing. You're almost there. One more deep breath here. And then slowly release, sliding the jaw back to neutral. You might kind of massage around the sides, open and close. And again, like I say a lot in my videos with muscle energy technique, if there's one side that's still holding on to some tension, you're certainly welcome to go back and repeat another round or two of muscle energy technique. But let us know how this worked for you. Let us know if you have any questions. There's another video I would recommend to do either before this or after, where we're targeting the SCM, the sternocleidomastoid, because when there's a lot of tension in this muscle in the side of the neck, it can cause some tension in the jaw. So head over, I'll put a link to that video in the bio, as well as a link to Integrative Yoga Method Online, where we've got all of our full-length classes, courses, and lots of great content for you. So thanks, yogis. Stay well.